Hello, my name is Valerie Weekly, and I would like to introduce you to parts of the world of nursing. Everyone has heard of nurses, I'm sure, at one time or another. We have had to come into contact with a nurse, whether it be in a doctor's office or a hospital. They serve the same purpose. A nurse is a person educated and trained to care for the sick or disabled. I suppose you could say that even moms are nurses too. They care for their children and have their best health in mind. Nurses provide a kind of assistance for persons, families, aimed at reaching and maintaining the best state of health. I think of myself as a nurse because I gave care to my stepdaughter and fiance. The reason being they both fought battles with cancer, and I cared for them as a nurse would be by doing some of the same things that a home health nurse would do. What I want to explain is what nursing is, including the promotion of health through education and vaccination, and give an example of what some nurses do. What is nursing? Nursing is the promotion of health. A nurse is formally educated and trained in the care of the sick or infirm. The word nurse was invented in 1350 to 1400, a noun from Middle English. Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through medical, diagnosis and treatment, of human response, and advocacy in the care of individuals, families, communities, and populations. The promotion of health includes a patient's right to privacy. Research suggests that nursing includes the prevention of diseases by forms such as vaccinations and educating their patients about health and right to privacy. Some responsibilities of a nurse. 1. They perform physical exams and health stories. They provide health promotion through counseling and education. They administer medications, wound care, and numerous other personalized interventions. They interpret patient information and make critical decisions about needed actions. They coordinate care in collaboration with a wide array of healthcare professionals. They direct and supervise care delivered by other healthcare personnel like LPNs and nurse aides. They conduct research in support of improved practice and patient outcomes. Nursing also includes the prevention of diseases. Vaccinations are the birth control for diseases. Seriously though, vaccines reduce the risk of infection by working with the body's natural defenses to help it safely develop immunity to disease. One of the latest nursing initiatives designed to prevent disease is called Bring Immunity to Every Community. The 2-year project from the American Nurses Association and the Center for Disease Control and Prevention focuses on nurses' key role in boosting immunizations in order to stamp out vaccine-preventable diseases. How many different types of nurses are there? There are cardiac nurses, registered nurses, licensed practical nurses, and even certified nurse assistants. The list goes on and on. There are at least 68 different types of nurses, if not more. One example is a case management nurse. The most important part of nursing is being a patient advocate. Everyone has heard about the notorious sponge bath, I'm sure. A case management nurse is a licensed nurse who coordinates patient care in a specific setting in order to provide optimal treatment. A case management nurse has several areas of care. He or she coordinates long-term care for their patients. The most common type of job position for a case management nurse is in a hospital or medical facility. Others work in retirement homes, rehabilitation centers, insurance companies, government agencies, or hospices. A case management nurse has many common tasks. Each and every one of us at some point in our lives has had to deal with nurses. Many case management nurses work closely with physicians, social workers, other nurses, and a wide range of medical and non-medical personnel. Some common tasks for a case management nurse are: keep detailed records of every case, home visit, every referral, and every contact with resources on client's behalf. They have to input accurate and complete data for all contacts with clients into the agency database. Ensure that all documents submitted on behalf of a client are valid. Serve as a patient advocate. Enhance a collaborative relationship to maximize the patient's and family's ability to make informed decisions. I want to express the importance of nurses. Whether it be a case management nurse or any of the other 68 kinds of nurses. Without nurses to help with our healthcare system, what would the world do? Nurses are there to bandage our wounds, give vaccinations, and inform us of our healthcare needs. The most important part of nursing is being a patient advocate. Nurses are not there for the doctors, but for their patients. It is often said that nurses treat the patients and the doctor treats the disease. Nurses are also our first line of defense the patients frequently come into contact with when we are ill. After learning to care for my stepdaughter who had osteosarcoma, which was a tumor in her leg, and fiance who had squamous cell carcinoma in his neck twice. With their battle with cancer, I have a new profound respect for the world of nursing. I believe nurses are special people. How about you?